Alright, welcome to our complete musculoskeletal review for USMLE and Shelf. In this video, we're going to have 100 musculoskeletal review questions, and the good news is, the slides are now available at my website at ajmonix.com. Let's begin with question 1. What is being assessed in this image over here? We have this physician over here, who I don't know why is extremely angry about something. But anyway, she's pushing down on the foot of this patient towards the table, and then rotating the tibia clockwise and counterclockwise. What's being assessed? So remember, this is the applique compression maneuver testing for meniscal injury. Compression is for meniscal injury, and distraction is for ligamentous injury. I like to think that the menisci are easily squishable. And since the menisci are easily squishable, when we compress or squish, we're testing for the menisci. And then if the patient reports pain on the medial aspect of the knee, we know it's a medial meniscal tear. And if there's pain elicited on the lateral aspect, we know it's a lateral meniscal tear. Question 2. A woman with osteoporosis develops epigastric burning after taking her osteoporosis medication. What is the medication's method of action? So this is a bisphosphonate, and a bisphosphonate is a pyrophosphate analog. It's called bisphosphonate because there are two phosphate groups. This is a pyrophosphate analog, not osteoblast inhibitors, they're osteoclast inhibitors, because osteoclasts resorb bone. That's exactly what bisphosphonates do, they inhibit that process. And I just wrote a note on the bottom over here that the patient can prevent esophagitis by remaining upright for 30 to 60 minutes after taking the medication. Alright, question 3. The NEAR test assesses for which condition? Dislocation, tear, or impingement. So NEAR, we bring it close to the ear because impingement, oh dear. Let's say it again. Near to the ear, because you bring the arm close to the ear, and impingement, oh dear. The NEAR test tests for impingement syndrome. Subacromial impingement syndrome, where there's pain with overhead activities. It's a clinical diagnosis, even though MRI is most accurate, and we treat it with steroid injection. Question 4. An anterior shoulder dislocation most commonly injures which nerve? And the answer is the axillary nerve. Remember, shoulder dislocations are most of the time anterior, while hip locations are most of the time posterior. Patients with anterior shoulder dislocation hold their arms in slight abduction and external rotation, and we need imaging, and we treat it with sling and swath. A reminder that posterior dislocations, which are uncommon, are seen in seizures. Question 5. Humerus fractures involve which nerve? So humerus fractures, at least mid-shaft ones, involve the radial nerve. And this of course can lead to wrist drop due to radial nerve palsy. Question 6. Paresthesia, pain, and sensory loss in the palmar aspect of the first 3 digits. While sensation over the thenar eminence is intact, this is nerve compression at the wrist. If nerve compression was at the forearm, we would see loss of sensation over thenar eminence. And this would be seen, for example, in pronator-Terry syndrome. Question 7. Fracture of the proximal ulna. This is Montagia fracture. And here's a cute little mnemonic, grimace. Grimace is the Galeazzi fracture, and that involves the radius, and it's inferior, meaning it's further away from the body, grimace. Nightstick fracture involves the ulna, and that's seen in self-defense. That's why it's called a nightstick fracture. Question 8. Passively flexing the thumb while the hand is held in ulnar deviation tests for Decker-Van tenosynovitis. This involves inflammation of the abductor pollicis longus and extensor pollicis brevis tendons. No imaging is required, because we have the test. We treat it with NSAID and spica-splinting. Question 9. Most common fracture at the base of the thumb. Bennett fracture. It requires closed or open reduction and surgical fixation to prevent malunion. Question 10. Foot drop is seen in injury to which nerve? And the answer is peroneal nerve. It took me a long time to figure out that peroneal was the same thing as fibular. This is a branch of the sciatic nerve, and a deep fibular nerve, or deep peroneal nerve, supplies innervation to the tibialis anterior and toe extensors, so they supply dorsiflexion. So without them, there will be foot drop. Question 11. Benediction sign. The inability to close the first 3 digits is seen in median nerve palsy. The median nerve supplies innervation for the muscles which close the first 3 fingers. So if we don't have the median nerve, we won't be able to close the first 3 fingers. The thumb, the pointer finger, and the middle finger. Ulnar nerve injury leads to the claw hand. That is, an inability to open the 4th and 5th digits. They look the same, we just have to recognize what's going on. Question 12. The bone that is fractured in a fall on an outstretched hand is the distal radius. This is a Colles fracture. This is the dinner fork deformity. And when there's medial nerve impairment, there's paresthesia in the lateral 3.5 digits, and we see impaired thumb abduction. Now here's my little mnemonic over here. We have this guy holding the dinner fork, and he's eating meat for medial nerve. And who is this guy, by the way? Colles himself. Abraham Colles, who identified the Colles fracture. Question 13. Which bone tumor is associated with the sunburst pattern and Codman's triangle? This is osteosarcoma. In Ewing sarcoma, we see onion skinning, and in giant cell tumor of bone, we see soap bubbles. Question 14. Which nerve is most often injured in a dashboard injury to the hip? i.e. a posterior hip dislocation, which as we mentioned is the most common type of hip dislocation. And the answer is sciatic nerve. Anterior hip dislocations, however, can injure the obturator nerve. Question 15. Achilles tendon rupture can be tested with the Thompson test, in which we squeeze the gastrocnemius and we don't see plantar flexion. Question 16. Claw hand is seen in ulnar nerve injury. We already mentioned this. It looks just like Benedict's hand, but the patient is trying to open up their hand. The Lachman test assesses the integrity of the ACL. As we'll see, it's the most sensitive test for ACL, even more than the anterior draw test. In the PCL, of course, we use the posterior draw test. Question 18. The Fallon maneuver tests which nerve? Of course, the median nerve. This is seen in carpal tunnel syndrome. A positive test is when there's tingling and numbness in the median nerve distribution. Question 19. Localized pain at the proximal anteromedial tibia aggravated by overuse and obesity. What is the diagnosis? This is anserine bursitis. It's also known as pes anserinus pain syndrome, and it occurs when the bursa, the fluid-filled sac inside the knee joint, becomes irritated and produces too much fluid, causing knee pain and tenderness. This can be especially seen when the patient is walking up and down stairs. Question 20. Vague pain around the kneecap, prepatellar, and localized pain focused behind the kneecap, retropatellar. This is patellofemoral pain syndrome. It involves anterior knee pain caused by overuse, and it's common in women, obese, and diabetics. We see decreased range of motion and erythema, and we treat it with rest, heat, and ice, and elevation, as well as NSAIDs. Question 21. Herniated discs most commonly involve the lumbar region, especially at L5 to S1, and we can test the herniated disc with a passive straight leg. If we can reproduce the radicular distribution of the pain or the paresthesia, that's a positive straight leg test. 22. Intense leg pain exacerbated by passive movement, tingling in the foot, and inability to move the toes. So this is compartment syndrome. And what's the treatment? Immediate fasciotomy. Pulses, by the way, in this condition may be palpable and maybe not. Lack of palpable pulses is often a late finding. Question 23. Septic arthritis management involves no antibiotics until culture results, meaning we don't give antibiotics until we get the culture, or we give antibiotics right away. And the answer is we give empiric antibiotics right away, ceftriaxone and vancomycin, because we need to treat. We don't wait for the cultures. We can modify treatment once we get the cultures, but we give antibiotics right away. 24. A man with a history of prostate cancer presents with back pain, decreased foot sensation, and bilateral leg weakness. What is the next step? We don't wait for the MRI. We want to give steroids right away because this is a dangerous situation. MRI would be the best study for this, but it's crucial to treat first. 25. 14-year-old boy has progressive leg pain. The CT shows a small nidus lucency in the fibula. What's the next step? So this is an osteoid osteoma which responds to NSAIDs because it's driven by prostaglandins. This is most common, by the way, in young males. Tumors may self-resolve, but surgery may be required for long-term symptom relief. Question 26. What is first-line treatment for acute gout attacks? And the answer is indomethacin, NSAIDs. NSAIDs are first line for gout. Colchicine can be used, but NSAIDs are better. Allopurinol is not for attacks, it's for maintenance. And steroids are used in things like renal disease, where patients can't have NSAIDs. And we give these steroids through injection. 27. Gout crystals display negative birefringence and are, so here we have gout. We know there's negative birefringence, and we know they're needle-shaped. The needles appear yellow when lying parallel to the polarizing axis, and blue when lying perpendicular. 28. The bamboo spine is seen in ankylosing spondylitis. We remember this is associated with HLA-B27. ESR and CRP are elevated in most cases, and we treat it with NSAIDs, and if refractory, TNF inhibitors or sulfasalazine. 29. A man presents with acute gout after a heavy night drinking. Which of his meds should he temporarily stop? And the answer is aspirin, because aspirin can cause reduced kidney excretion of uric acid, causing gout. 30. Best initial treatment of complex regional pain syndrome is NSAIDs. NSAIDs are the best initial therapy. Others include steroids, also low-dose TCAs, gabapentin, pregabalin, calcitonin, and chemical sympathetic blockage. 31. The diagnosis of fibromyalgia requires at least 11 painful areas. In fibromyalgia, we don't see inflammation, but we see painful areas. It's a myofascial pain syndrome, and we treat it with antidepressants, gabapentin, pregabalin, but we avoid narcotics, and we definitely avoid steroids. Question 32. A 67-year-old female with aching and stiffness in the shoulders and hip. ESR markedly elevated. This is polymyalgia rheumatica. Shoulders and hip is polymyalgia rheumatica. It affects older women. ESR is elevated versus fibromuscular dysplasia. 33. A 5-year-old boy with right hip pain and a slightly abducted externally rotated hip. He had a URI last week. This is transient synovitis. I'll show you a mnemonic in a second. And the next step is ibuprofen. This is the mnemonic that I like. It's one of the worst mnemonics in the entire planet, but that makes it memorable because you're able to look at it and think, this is such an awful mnemonic. and then you laugh at it. Through that, you remember how a patient with transient synovitis would hold his leg in abduction and external rotation. 34. A 60-year-old man has bone pain, headaches, unilateral hearing loss, and femoral bowing. What's the pathophysiology? So this is Paget disease, in where we see osteoclast dysfunction. And here's a little bit about Paget disease. You can take a look. Question 35. A 10-year-old obese girl with a limp cannot bear weight on her left leg due to pain. The left hip is in external rotation. The x-ray shows a posterior displaced femoral head. What's the treatment? So this is slipped capital femoral epiphysis, and we treat it with immediate surgical screw fixation, and this is often bilateral in 45% of cases. 36. A woman fell 2 weeks ago and now has trouble abducting her arm without severe pain. What's the diagnosis? So this is not adhesive capsulitis. There we wouldn't see pain, we would see more stiffness. This is a rotator cuff injury. May present as shoulder pain and difficulty with abduction due to injury with the supraspinatus, which is the most commonly injured rotator cuff muscle. 37. A 4-year-old boy is not moving his right arm after being swung around by his father. So this is nursemaid's elbow. What's the next step? Gentle pronation. There are 2 ways to treat nursemaid's elbow, either with gentle pronation or supination and then flexion. 38. A 36-year-old woman on steroids for sarcoidosis presents with severe right hip pain. Forced abduction and internal rotation of the femur exacerbates the pain. The x-ray shows nothing. So what's the etiology? Why is she getting this hip pain? And the answer is she's taking steroids, so she developed avascular necrosis of the femoral head. This avascular necrosis of the femoral head is associated with SLE, steroid use, alcohol abuse, antiphospholipid syndrome, and other conditions. And it diagnoses with MRI, and we treat it with surgery. 39. A female tennis player presents with right heel pain worse on passive dorsiflexion of the toes. So this is plantar fasciitis. The best initial treatment is padded heel inserts. Steroid injection is not first line. It could be considered if the pain persists. Question 40. Which type of fracture will more likely lead to limb length discrepancy if not treated properly? And the answer is a growth plate fracture. Green stick fractures tend to not have any long-term consequences, but growth plate fractures can lead to limb length discrepancy. 41. What is the best initial management of chronic nonspecific low back pain? And the answer is PT to strengthen the back muscles. We don't want to stop work until the pain is resolved. That has been shown to have worse outcomes. And intermittent NSAIDs and Tylenol may also help. 42. An obese 60-year-old female presents with medial plantar heel pain, worse with activity, and reproduced by medial lateral squeezing of the calcaneus. So this is a calcaneal fracture. What's the next step? We want an x-ray of the foot, because again, this is calcaneal stress fracture caused by repetitive microtrauma. We treat it with analgesics and activity reduction. 43. Prolonged use of which of the following is associated with increased risk of atypical stress fracture of the femur? And the answer is alendronate. The very medication which is used for osteoporosis to prevent bone breakdown can lead to stress fractures. And that's why patients who take it should have a drug holiday for 3 to 5 years after 5 years on the drug, in order to avoid the development of these atypical stress fractures. 44. Chronic lateral hip pain worse with hip flexion. The PE reveals trochanteric tenderness. What's the diagnosis? Greater trochanteric pain syndrome. This is not iliotibial band syndrome, because there we'd see lateral knee pain. This is greater trochanteric pain syndrome. We treat it with heat activity modification, NSAIDs, and if there are persistent symptoms, we may give a steroid injection. Question 45. Carpal tunnel syndrome is a common manifestation of which condition? And the answer is rheumatoid arthritis. By the way, rheumatoid arthritis is also associated with tarsal tunnel syndrome, which is kind of like the carpal tunnel syndrome of the foot. Anyway, carpal tunnel syndrome is also seen in pregnancy, and in that case it usually resolves after the pregnancy. And carpal tunnel syndrome is also the most common mononeuropathy in patients with end-stage kidney disease on dialysis. Question 46. A driver endures a femur fracture and now has respiratory distress, neurologic dysfunction, and a petechial rash. This is an air embolism. What's the next step? Supportive care. There's no treatment for air embolism. But the good news is, it's not as dangerous as a pulmonary embolism. But still, we need to treat with supportive care because it could be life-threatening. Question 47. What's the best initial treatment for an asymptomatic ganglion cyst? And the answer is observation. We don't treat asymptomatic ganglion cysts. More than 50% of them resolve spontaneously and don't require treatment. And by the way, I wrote a fun fact over here on the bottom. They're also called Bible cysts because people used to use their Bibles to hit the cysts to get rid of them. And FYI, don't do that. Question 48. A 16-year-old girl has a 1-month history of back pain with radiation to the buttocks associated with activity. Pain is reproduced with lumbar extension, so this is spondylosis. If we saw a step off, it would be spondylolisthesis. And what's the next step? So here we want to get an x-ray to confirm the diagnosis. We don't want to get a CAT scan. We try to avoid that in children. And also, we'll get what we want straight from the x-ray. If we confirm the diagnosis, we limit activity for 3 months. 49. A 42-year-old man presents with acute monoarticular arthritis with chondrocalcinosis and hepatomegaly. This sounds like hemochromatosis with arthropathy. what test should be done next. So we want to check the iron because that's what's seen. In hemochromatosis, there's an iron overload. And we confirm the diagnosis of hereditary hemochromatosis with genetic testing. Question 50. A 50-year-old woman has fatigue and muscle pain in her arms, shoulders, and knees. CRP is normal. What's the diagnosis? So here, fibromyalgia. CRP is normal. That wouldn't be seen in the other conditions over here. It wouldn't be seen in polymyalgia rheumatica or polyarteritis nodosa. Remember, in polyarteritis nodosa, we see skin findings, kidney disease, abdominal pain, and muscle aches. Question 51. A 63-year-old man has right knee pain after missing a step on his stairs. Passive range of motion is intact, but he can't extend his knee against resistance or keep his knee straight with hip flexion. So he can't extend his knee. That's a patellar tendon rupture. Patellar tendon rupture, the patient has a difficult time extending his knee against resistance. These ruptures typically occur just distal to patella, and the patella may ride high as we see in the image, and this is called patella alta. This condition requires surgery. Question 52. A young man with inflammation and pain at his heels, iliac crests, right shoulder, and tibial tuberosities with elevated ESR and CRP may also have, so we're talking about a young man with these conditions. This is ankylosing spondylitis, where we also see limited spine mobility. Patients with this condition may have limited breathing ability due to stiffness of the rib cage. Question 53. An 83-year-old man in pain has an acute, shortened, externally rotated left leg after a fall. This is most consistent with a femoral neck fracture. Remember, in femoral neck fractures, the leg is externally rotated, while in posterior hip dislocations, it's going to be internally rotated. An overuse heel pain injury common in boys aged 8 to 12 who participate in sports is Sever disease. Sever disease is also known as calcaneal apophysitis. 55. A 3-year-old boy sustains a spiral fracture to his tibia at daycare. He has no other injuries. This is most likely accidental. Children who just begin to walk may also get spiral fractures. And since this boy over here has no other injuries, there's no reason to assume over here that this was abuse. 56. An MRI should be considered in a patient presenting with back pain and which of the following? And all of these are indications for MRI. For example, in acute urinary retention, that could be cauda equina. If there's fever, it could be an abscess. If there was recent malignancy, it could be metastasis. And if there's focal spine tenderness, that could be a disc degeneration. 57. Joint pain, eye pain, and pain with urination. So this is reactive arthritis, also known as Reiter syndrome. Remember, can't see, can't pee, and can't climb a tree. There's no specific test for this. And although it's associated with bacterial infection, antibiotics don't help once the joint pain has started. 58. A 7-year-old girl has intermittent nocturnal bilateral leg pain episodes that last about 20 minutes and then resolve. PE is normal. What's the next step? So reassurance, because these are just growing pains, which often affect the anterior thighs, calves, and shins. Again, there's no treatment for growing pains, as it often self-resolves by adolescence. 59. The Thesely test is used to assess the medial meniscal tear. Remember, we spoke about the Apley maneuver at the beginning, and this is the Thesely test, which is very similar to the Apley maneuver, as the patient does it standing up. This could also test for the lateral meniscal tear. Question is, where's the pain? If it's lateral, it's a lateral meniscus, and if it's medial, it's a medial meniscus. Question 60. A boy presents with left knee pain, worsened by activity, and has prominent tenderness over the tibial tubercle. What is the diagnosis? So this is Osgood-Schlatter syndrome, which affects the tibial tuberosity, and this condition self-resolves. Question 61. A 13-year-old girl now has low back pain exacerbated by lumbar extension, and PE shows a palpable step-off. So we spoke about this before. It's not just spondylosis, it's spondylolisthesis. There's anterior slippage of the vertebral body caused by a bilateral defective pars lenticularis. There's conservative treatment, but surgery for severe cases. Question 62. A 7-year-old boy presents with a 2-month history of left limp and knee discomfort. He had a URI last week, but that doesn't matter because he had a 2-month history of the limp. So this is Legg-Calvé-Perthes disease, seen in young boys who have a painless limp, and it involves avascular necrosis of the femur. 63. A 61-year-old woman falls and braces herself with her hand, injuring her wrist. The x-ray is shown. So we have the dinner fork deformity here. Associated nerve injury would most likely involve, so we're talking about the median nerve, and this would involve abduction of the thumb. 64. A 39-year-old woman has acute knee pain, fever, along with signs of synovitis, warmth, and swelling, and the x-ray shows joint diffusion and aspiration yield, leukocytes, cultures are sent, and antibiotics are started. What's the next step? So here we want to get drainage of the knee, because we're dealing with septic arthritis. We don't need to get an MRI, because we already have imaging showing the effusion. Question 65. Acute uncomplicated low back pain is first treated with NSAIDs. If there's no relief, what's the next step? So we go with muscle relaxants. For example, cyclobenzaprine and tizanidine. 66. Poorly localized lateral knee pain in a runner. This is iliotibial band syndrome. Remember, lateral knee is iliotibial band. Pes anserine bursitis would be medial. Question 67. A 3-month-old girl prefers to tilt her head to the left while rotating her chin to the right. A firm mass in the inferior portion of the left sternocleidomastoid can be felt. What's the cause? So this is a muscular defect. This is torticollis or torticollis. 68. Complications of diabetic neuropathy include all of these: ulceration, subluxation, arthropathy, and hammer toe. Charcot arthropathy. We'll talk more about this soon. Question 69. A woman presents with greater trochanteric pain syndrome, unresponsive to NSAIDs. What's the next step? So here we give a steroid injection. Pregabalin, that's for fibromyalgia pain. Question 70. A 49-year-old man has bilateral muscle weakness and has difficulty rising from a chair. There are erythematous patches and papules on the dorsum of his fingers. What's the pathophysiology? So this is dermatomyositis, and this is an inflammatory myopathy. We see these Gottron papules and a heliotrope rash. Question 71. A 23-year-old female lawyer, blah blah blah, has joint pain, blah blah blah, after she had an illness. What's the diagnosis? So joint pain after an illness, that's likely viral arthritis, especially with parvovirus B19, seen in adults where patients get joint pain that clears up. And you can take a look at these other choices over here. Another question 71. A man with hyperparathyroidism with chronic hypercalcemia now has knee joint pain with swelling and erythema. What will be found in arthrosclerosis synovial fluid assessment? So here he has hypercalcemia. Remember, that is pseudogout, rhomboid-shaped crystals. Pseudogout is caused by calcium pyrophosphate crystals, and we see these rhomboid-shaped crystals with positive birefringence. 72. A diabetic presents with mild foot pain for several months. The X-ray is shown. What is the pathophysiology? So remember, we spoke about Charcot arthropathy, and what happens is they have impaired sensation and proprioception, so they smash their foot a lot. Man has left ankle pain after falling on the lateral side of his foot. NSAIDs haven't helped. There's no tenderness to palpation of the romaine prominences of the ankle, but there's bruising. Sensation is normal. You can take 6 steps. What's the next step? So here we go with ankle brace. We don't get imaging according to the Ottawa ankle rules because he can take a few steps and he doesn't have any tenderness over the medial malleolus. Question 74. Paget disease of bone increases risk of what bone malignancy? And the answer is osteosarcoma by several thousand times compared to the general population. 75. Gout attacks can be reduced by reducing alcohol. Smoking actually has been shown to reduce gout attacks. Alcohol, however, increases uric acid production. Patients also want to reduce the amount of red meats they have and refined sugars. 76. A mechanically induced degenerative neuropathy that causes numbness and burning in the distal forefoot from the metatarsal heads to the 3rd and 4th toes. This is Morton's neuroma. It can never go away. We treat it conservatively with NSAIDs and padded shoe inserts. 77. Pelvic fracture hemorrhages are most often due to veins, not arteries, but veins. The venous plexus and pelvic binder should be applied as soon as possible. Now I just wrote a note on the bottom over here that we treat hip fractures with surgical fixation. We want to do it within 24 hours if the patient is medically stable. But if the patient's unstable, we can delay it up to 72 hours to evaluate surgical risk. 78. Left-sided shoulder pain after a splenic rupture is due to which nerve? So why would there be shoulder pain after a spleen rupture? That's due to phrenic nerve. It's called the Kerr sign. Question 79. After sustaining a hip dislocation in a car crash, a man has reduced left knee extension. So he has reduced left knee extension. This sounds like a femoral nerve problem, along with decreased sensation on the left anterior thigh. Again, consistent with femoral nerve injury. This is femoral nerve injury, as the femoral nerve provides sensation to the anterior thigh and medial leg, and it's responsible for knee extension and thigh flexion. So that's what was damaged over here. 80. Loss of hip abduction is seen in injury to which nerve? So which nerve supplies hip abduction? And the answer is superior gluteal nerve, because it is responsible for supplying innervation to the gluteus medius and minimus, the hip abductors. This nerve can be damaged, for example, in hip injuries or in buttock injections if you inject into the wrong area. 81. Foot drop is seen in injury to which nerve? So we discussed this before, the peroneal or the fibular nerve. 82. Which joint is spared in rheumatoid arthritis? And the answer is the DIP. RA patients still got the dip. 83. Volkmann contracture is a complication of compartment syndrome, in which there is a permanent flexion contracture of the hand at the wrist. 84. An avulsion fracture of the 5th metatarsal bone. Is that Jones or Dancer? Dancer. Dancer is also known as pseudo-Jones because it looks like Jones, but the Dancer is one where there's an avulsion. 85. What is this test? The physician is pushing anteriorly on the shoulder over here, and this is the apprehension test. It's called the apprehension test because the patient's face apprehensive. He's very nervous that his shoulder is going to be dislocated, and this tests for glenohumeral instability. 86. The opposite of a Colles fracture is a Smith fracture. The Smith fracture is when the patient lands on the back of their hand. 87. AC separation type 5, meaning a person has a clavicle fracture separating the clavicle from the shoulder joint. This requires surgery. Remember, acromioclavicular separation types 1 to 2 require no surgery, but types 3 to 6 require surgery. 88. A 74-year-old granny developed back pain after breakdancing. While supine and her knee extended, flexion of the right hip produces achy pain behind the right thigh. What is the diagnosis? So don't be fooled over here. This is not a herniated disc. If this were a herniated disc, then if we extended her thigh, it would reproduce pain along the distribution of the radiculopathy. This is pure lumbosacral strain, what you would expect from a 74-year-old granny who started breakdancing. 89. The best initial test in suspected scaphoid fractures is X-ray. It's true that MRI is most accurate, but the initial test is X-ray. And what's a complication of a scaphoid fracture, which by the way is the most common carpal bone fracture? Avascular necrosis. 90. Bone overgrowth at the first metatarsophalangeal joint causing pain. What's the treatment? So this is a bunion. Doesn't always cause pain, but when it does, we go with surgery. You could see the x-ray of that over here. By the way, bunions are also called hallux valgus. 91. Pain and swelling at the posterior elbow in a student. So this is student's elbow, also known as olecranon bursitis, and the treatment for this is rest and ice. It's associated with certain types of professions. 92. A 45-year-old woman complains of finger, skin, tightness, and esophageal discomfort. This is Crest syndrome, of course. I like to imagine a centromere on top of a crest of a hill. This reminds me of Crest syndrome that we see anti-centromere antibodies. And Crest syndrome is seen in limited cutaneous systemic sclerosis versus the diffuse disease. 93. Which of the following depicts the most common knee tear? So remember, the most common is ACL tear. And ACL tear is seen in A over here. Remember, the ACL inserts by the tibia. It courses a bit medially. And recall, finally, the unhappy triad, which consists of the ACL, the medial collateral ligament, and the medial meniscus. Basically, the three structures which are more medial. Remember, we just said that the ACL courses medially. 94. The shopping cart sign is a sign of, for shopping cart signs, when the patient bends over in flexion and that relieves their pain. So this is lumbar stenosis, and it's diagnosed with MRI. And we treat it with weight loss, pain medications, and steroids, and surgical correction is often needed. 95. What is the treatment for this condition? Well, this is Poitrin contraction, triamcinolone lidocaine, or a collagenase injection. Surgery is only if there's function impairment, but this is not usually the case. 96. Hemarthrosis and bleeding gums and petechiae associated with scurvy, vitamin C deficiency, which causes a problem with collagen synthesis. 97. What's the most sensitive non-imaging test for acute ACL tear? So we mentioned this at the beginning. The most sensitive test is the Lachman test. Here's a picture of the Lachman test. 98. Which muscle begins arm abduction? And this is the supraspinatus, the muscle which is most commonly injured in rotator cuff injuries. 99. Which muscle is most often implicated in tennis elbow? The extensor carpi radialis brevis. Question 100. Winged scapula occurs due to damage to which nerve? So remember, we're dealing with the serratus anterior, and that's innervated by the long thoracic nerve. So we have damage to the long thoracic nerve that will lead to winged scapula. Alright, that's the end of this video over here. I hope you enjoyed. Remember, you can find these slides by my website. For the other topics which I've covered as well, I'll post those too. Alrighty, take care.